Evaluation of Sinopharm COVID-19 vaccine effectiveness in Sri Lanka, a test-negative case control study. Coronavirus disease 2019 is a global pandemic caused by the systemic acute respiratory syndrome coronavirus 2. The disease was observed to be more severe in the older population and in those with chronic underlying diseases. SARS-CoV-2 spread more rapidly compared to other previously known coronaviruses. To date, COVID-19 has caused 620.8 million infections and 6.5 million deaths worldwide. Vaccines against COVID-19 play an important role in reducing the incidence and mortality due to the disease. The World Health Organization provided emergency use listing procedure for emergency use of vaccines. These were mRNA vaccines like the Pfizer, non-replicating viral vector vaccines like the AstraZeneca, and inactivated vaccines like the Sinopharm. The first COVID-19 confirmed case in Sri Lanka was in March 2020. To date, there have been 670,918 confirmed cases and almost 16,800 deaths due to COVID-19 in the country. The COVID-19 vaccination program in Sri Lanka commenced in January 2021. Currently, 5 vaccines are approved for use in Sri Lanka. With almost 23 million doses administered so far, Sinopharm is by far the most commonly used vaccine in the country. Although studies on the effectiveness of vaccines like Pfizer, Moderna, and the Oxford AstraZeneca are many, research on the real-world effectiveness of the Sinopharm vaccine is scarce. The WHO approved emergency use of the Sinopharm vaccine in May 2021, and it is currently used widely in many countries. Most of the Sri Lankan vaccination program is covered by the Sinopharm vaccine. Research into the real-world effectiveness of this vaccine is therefore a necessity in this country. These are some of the many studies that have been carried out into Pfizer's Sputnik, Moderna, and AstraZeneca vaccine in the last 2 years, looking at the efficacy of these vaccines at preventing infection, reducing hospitalization, and reducing mortality. These are the 3 studies that have been carried out so far, real-world studies, looking at the efficacy of the Sinopharm vaccine. 2 of the studies have been carried out in the United Arab Emirates, and the 3rd is from Argentina. The objective of our study was to evaluate the real-world effectiveness of the Sinopharm vaccine against COVID-19 in Sri Lanka. Methods. A test-negative case control study was conducted at 9 government hospitals in Sri Lanka, covering all 9 provinces. This was an island-wide study. Consecutive adults aged 18 years and older who had RT-PCR tested for suspected SARS-CoV-2 from December 2021 to June 2022 were interviewed by telephone using an interviewer-administered questionnaire with informed verbal consent. Vaccination status was verified with vaccination cards and data from the epidemiology unit of the Ministry of Health. All data was directly entered into a centralized system maintained by the Faculty of Medicine, University of California. These were the hospitals, the large hospitals, one from each province, that took part in the study. And this is a screenshot of the RedCap data capture system that we used to collect data from each of the hospitals. The sample size calculation was done using the WHO online calculator. The test-negative case control design is the best method that is generally done for vaccine efficacy studies. These are the inclusion and exclusion criteria of the study. Persons who received only one dose of the Sinopharm vaccine and those who received 2 doses of the Sinopharm vaccine but were within 14 days of the second dose, and those who received at least 1 dose of a COVID-19 vaccine other than the Sinopharm were excluded from the study. Results. 1,829 persons were recruited. 50% of them were male, and the mean age of the sample was 45.2 years. 904 developed COVID-19 infection. 1,634 persons were vaccinated with 2 doses of the Sinopharm vaccine, while 195 persons were vaccine naive. Compared to the vaccinated, the unvaccinated persons were older, but were otherwise similar in their demographic and medical profiles. The unvaccinated had a higher incidence of COVID-19 infections. The unvaccinated had 79% COVID-19 infections compared to 46% of the vaccinated, and this was statistically significant. The unvaccinated who developed COVID-19 infections had significantly more symptoms of fever, arthralgia and myalgia, headache, shortness of breath, runny nose and nasal congestion, and sore throat and vomiting compared to the vaccinated persons who developed COVID-19 infection. The majority of the vaccinated who developed COVID-19 infection received treatment at home, and they had a lower requirement of oxygen. Both these parameters indicate that the vaccinated who developed COVID-19 infection developed less severe illness. And very importantly, those who developed COVID-19 infection and were vaccinated had significantly fewer deaths compared to the unvaccinated who developed COVID-19 infection. So, ladies and gentlemen, in conclusion, in this island-wide study involving almost 2,000 persons, the Sinopharm vaccine reduced COVID-19 infection in the vaccinated. The Sinopharm vaccine was effective at mitigating the severity of illness in COVID-19. And the Sinopharm vaccine reduced the likelihood of hospitalization, severe illness,